So 2020 has been declared by the World Health Organization as the year of the nurse.
Nurses are voluntarily living in their basements and in their garages to protect their families and also to protect themselves so that they can return to work.
The way that nurses throughout our nation, across the country, have volunteered, taken vacation time, gone to the front lines, put themselves at risk in order to help others. I'm very proud of that.
From local to global, nurses face challenges with no hesitation, and nurses risk lives to save lives.
Nurses have demonstrated long-term health values of nursing, leaving families and loved ones to care for all.
Nurses are carrying out vital research to help us understand the COVID-19 virus. And nurses are organizing support for our professional needs and advocating for the safety of our patients and our communities.
I am so proud of the role that nurses have played in providing compassionate, loving care at the bedside during this COVID-19 pandemic.
During this global health crisis, my nursing colleagues were true leaders. I was in awe when a group of new Barry University alum and students traveled from Miami to New York to join the front line. I witnessed my faculty head to a shelter to protect the homeless population because they were vulnerable.
Faculty have demonstrated leadership in this crisis by exemplary efforts quickly transitioning to remote teaching approaches. Graduating students are eager to begin their career by applying for a 90-day temporary license available through an executive order by our governor.
This pandemic yearns for leadership, and we have seen countless examples in our University of Minnesota community. From BSN alumni leading efforts at the Mayo Clinic to DNP students leading at Mount Sinai Hospital in New York. From psychiatric mental health students creating a video to help others face COVID to our faculty quickly pivoting to online simulations using standardized patients for our Masters of Nursing students.
I am so proud of the 24/7 efforts of our faculty, staff, and students to serve on the front lines of care delivery, conduct virtual research, provide innovative telehealth services, and convert learning and working environments online.
I am thankful for and proud of our UC faculty and staff who embraced change and acted as true leaders to create and implement innovative approaches to nursing education.
Nursing faculty and students at Florida International University have been involved by testing for COVID-19 patients, by assisting the National Guard as they have moved to establish a field hospital in the Miami area.
I am very proud of the way that our faculty and staff and students have responded in this pandemic crisis. The mayor of the city where our school is actually based came to us and asked us if we would put together a pool, a resource pool of nurses and others who could be called upon in the event of a surge that we have seen happen in other cities across the country. We did so and instantly had about 150 volunteers on the first couple of days.
Our college responded to the COVID-19 crisis by offering our simulation centers and our parking lots to the county commissioners in Fort Bend and Harris County.
To date, we have sewed over 6,000 masks for the University of Maryland Medical Center employees. These masks have been made by faculty, staff, students, alumni, friends of the school, and many volunteers from the community.
And here in my community of Boston, Simmons University is providing housing for healthcare workers. Our nurses are starting nonprofit organizations for food distribution. They're also beginning delivery programs for the elderly in their neighborhoods.
I was inspired by our nursing colleagues who, instead of stepping back in fear, leaned right in, forming the misinformed to halt the spread of fake news, connecting patients with their families using their smartphones, and courageously taking a stand to protect themselves and their colleagues.
I've witnessed many patient testimonies expressing gratitude to nurses for their life-saving role. Nurses, known for compassion, clinical expertise, character, and tenacity.
AACN's guideline for placing student nurses in clinical settings during the pandemic was critical to my decision-making. Thanks to AACN and our academic health system, nursing students continue to be valued members of the team.
I have witnessed unwavering commitment to the oneness of community, unprecedented compassion, and extraordinary creativity and innovation for co-creating the new in healthcare, the new in education, and the new in society. We are deeply grateful to AACN for their exceptional leadership in lifting up the voice of nursing.
I thank AACN for leading the effort to support academic nursing and frontline nurses.
I want to say thank you to AACN for the support it has offered schools of nursing during these unprecedented times.
When I think about kindness, of course, it is all about nursing.
This is why I am so proud of my profession.
To nurses everywhere,
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you very much.
We are forever grateful.